So once again, everything is about gestational hypertension, except so let's see the answers. Okay, the answer is clear because these are criteria to say it is gestational hypertension, but it is very important to distinguish it from the preeclampsia, and the main thing is proteinuria. Isn't it, Shala?
That is correct, yeah. So gestational hypertension, it is similar to preeclampsia without severe feature, or maybe in your country you call it mild preeclampsia, similar, but it has no protein in urine.
Thank you. Let's go further. So again, the majority was right. So this is the lower limit, so to say. But if you have higher blood pressure, 160 and 110, then this is criteria for severe feature, and this would not be. This is without severe feature.
Correct, correct, absolutely.
So, what would you not do with labs? So correct. We said, and always think of that. So you would not include first diazepam and phenytoin, but
first the
magnesium sulfate.
The antihypertensive drugs.
Yes, and also Shala, we would comment. Dr. Bulatovic always repeat that in the practice when we you should usually perform first anticonvulsive therapy and then antihypertensive therapy.
Yes, yes.
Is that true? But
that's
if
true.
You don't have maybe immediately the drug in the ward, then maybe you will skip sometimes. But by the rule, you should give first magnesium sulfate.
First magnesium sulfate, yeah, you're preventing seizure. Yes, yes, absolutely. If you have more than one hand, that's great. Teamwork, if you have more than one person, but if you have one, I would choose the magnesium first and then get the antihypertensive medicine.
I see.
Yes, of course, I agree, because you don't have the brain damage because of the hypertension, but because of the edema of the brain, you will have convulsions. So if you stop the eclamptic convulsion, you will protect the brain from further edema and further eclamptic seizures.
Correct.
Remember that. Participate. Let's go next. So HELP syndrome include the following, except correct. I think there is no doubts. So this is tricky, and these patients are maybe the most serious because they don't have the clinical aspects, yes, and the first maybe idea of hypertensive disorder, but they will have very serious disorder in the basis, yes?
That's correct, yes. And, you know, it like you said, deceiving. It should mimic other presentations, and not always hypertension is present, correct.
So let's go to the final question of final quiz. What would you use for prevention? So Shala, this was a little bit maybe not catched during the presentation, but let's these were the final slides, so maybe we should repeat that. Low dose in first trimester in women in which you will, by the history or anamnesis or by the previous her experience in pregnancy, get the data that she had hypertension. Yes.
So the practice here, if you had history of severe preeclampsia, or you had preeclampsia more than once, they do give aspirin. Even if you have chronic hypertension, really they're given aspirin for a lot of, now they're given aspirin, they're more comfortable to give aspirin with a lot of other conditions, and, so preeclampsia, chronic hypertension, advanced maternal age, history of IUFD, systemic disease like lupus or other renal diseases. So we're getting more comfortable. Diabetes, we're getting more comfortable to give aspirin at 12 weeks for preeclampsia or for the other reason. Like I have a lady with twin pregnancy, and she's taking aspirin. So I think we're getting more comfortable to prevent complication. We're more comfortable using aspirin now.
Yes. And the other correct answer would be that calcium also may prevent hypertension and preeclampsia.
Yeah, so calcium, if someone's diet doesn't have enough calcium, they have low absorption, or they have issues with absorption of calcium, definitely calcium. I recommend Tums because it's easy, like antacid, because it's easy absorbed.
Yes.
Yeah.
Super. Thank you very much. Let's see who won the first place. Congratulations, Raduleska. Sorry.